Hi, I'm Keith Carricker, and I have had problems with my left knee for many years. I had to adjust my golf swing, I had to adjust how I walked. I eventually, 4 or 5 months ago, gave up golf because I just couldn't get to my left side. So that was one of the reasons why I saw a friend of mine who's a pain manager, and he said, "Keith, you need to have your knee replaced." I asked him who I should go see, and he highly recommended Dr. Wayne Lee to take care of this left knee. I'd had surgery about 20 years ago, a couple of arthroscopic surgeries and then a hardcore surgery. And what I remembered about that was how dreadful or painful the recovery time was and the therapy was. So that was what my primary concern was after surgery. Dr. Lee came with a great reputation, so I had no concerns about that. Once I woke up from the surgery in Methodist Hospital, the folks there couldn't have been better for me. They treated me like a VIP, and I felt really good about that. I was discharged the day after that, went home. I was given multiple kinds of pills to take to help diminish the pain and help with everything else that took place. I had occasion to call a couple of times. I wanted a shower. Dr. Lee wouldn't relent and let me take a shower 2 days after surgery. But since that time, I have progressed through the assistance of a couple of therapists to the point now, after 2 weeks and 1 day, I'm walking half a mile 2 to 3 times a day. Yesterday I did it without a cane. I've not used crutches. I don't use a cane around the house. And I'm getting along very well. So I feel the therapist measured me yesterday for my range of motion. I get 180 degrees with a straight leg. With a bent knee, I can go 110 degrees. They were striving for 90, but yesterday I did 110. So that tickles me a bunch, and it makes them feel good.